Welcome to the deep dive. Today we're getting into something really important, especially if you have a dog or might someday. Canine Diabetic Ketoacidosis.
DKA, for
Wait,
sure.
right, DKA. It's a serious complication of diabetes in dogs, and knowing about it is, well, pretty crucial.
It really is potentially life-threatening.
So our mission today is to pull out the key info from our sources, make it super clear what this condition is all about. It basically boils down to a lack of insulin, yeah.
Exactly. Without enough insulin doing its job, the dog's body just can't use glucose sugar for energy in the right way.
Okay, so insulin is like the doorman, letting glucose into the cells.
That's a good way to put it. It unlocks the cell door so glucose can get in and provide fuel.
So if the doorman's missing or maybe the lock's broken,
Yeah.
what happens?
Well, if there's not enough insulin, that's an absolute deficiency, or the cells just aren't responding to it properly, a relative defificiency, like your broken lock idea, the glucose can't get in.
It just stays stuck outside,
Well,
in the blood.
precisely. It builds up in the bloodstream, causing hyperglycemia. That's just, high blood sugar. The cells are starving, even though there's plenty of sugar floating around.
Wow. So the body's panicking, thinking it needs fuel?
It is. It thinks it's starving, so it switches gears. It starts breaking down fat reserves for energy instead.
Ah, the backup plan.
Kind of. But this backup plan has consequences. Breaking down fat releases things called free fatty acids into the blood.
Okay.
Then the liver gets involved. It takes these fatty acids and converts them into ketone bodies. You might have heard of acetone, that's one of them. Beta-hydroxybutyrate and acetoacetate are the other main ones.
Ketones. Right, I've heard that term. They're not good in large amounts.
Not at all. As these ketones build up, you get a state called ketosis. And the real problem is that these ketones are acidic.
Acidic.
Yeah.
So they make the blood acidic.
Exactly. They overwhelm the body's buffering systems, lowering the blood pH. That's metabolic acidosis.
That sounds bad.
Yeah.
Really bad. Does the body try to fight it?
Oh yeah, it tries. One really noticeable thing is how the dog breathes. It's called Kussmaul respiration.
Small. What does that look like?
It's this deep, kind of rapid, labored breathing, almost like panting, but deeper and more forceful.
Trying to blow something off?
Essentially, yes.
Yeah.
They're trying to blow off carbon dioxide, CO2, which is acidic when dissolves in blood. It's the body's way of trying to physically remove acid and raise the blood pH back up. It's quite a dramatic effort.
Fascinating. But the problems don't stop with the acid, do they? You mentioned high sugar earlier.
Right. The high glucose and the high ketone levels do something else. They make the blood hyperosmolar,
Hyperosmolar, meaning
meaning it's super concentrated, like syrup instead of water. This high concentration pulls water out of the body's cells and into the bloodstream.
Okay.
All that extra fluid in the blood vessels overwhelms the kidneys. They try to filter it out, leading to excessive urination. That's polyuria.
Ah, so that's why diabetic dogs drink and pee so much sometimes.
Exactly. And losing all that fluid makes them incredibly thirsty, polydipsia. But they can't drink enough to keep up. This cycle leads to really significant dehydration.
And that probably messes up electrolytes too.
Absolutely. Things like potassium, sodium, phosphate. They get flushed out or shifted around in the body. It creates major electrolyte imbalances on top of the dehydration and acidosis.
What a mess. Okay, so we get the why. Now, if this is happening, what would an owner actually see in their dog? What are the warning signs?
Yeah, recognizing the signs is key. As we just discussed, that excessive drinking and urination, polydipsia, and polyuria are classic early signs, often linked to diabetes itself, but really ramped up in DKA.
Okay, increased thirst and peeing. What else?
Lethargy is a big one, just really low energy, weakness. That's down to the dehydration, the acidosis, the electrolyte problems.
Mm-hmm.
The cells just aren't getting energy properly.
Makes sense. Any gut symptoms?
Yes, often. Vomiting and sometimes diarrhea can happen because the acidosis irritates the stomach and intestines.
So they might stop eating too?
Very commonly, yes. Anorexia or loss of appetite is typical. And then there's that breathing pattern we talked about.
The Kussmaul breathing. Deep and labored.
Right. That's a pretty strong clue something serious is wrong. And maybe the most specific sign.
You're on.
Sometimes owners notice a strange smell on the dog's breath. It's often described as fruity or like nail polish remover.
Fruity breath. Really?
Yeah, that's the acetone, one of those ketones being expelled through the lungs. It's quite distinct if you notice it.
Wow. That's definitely one to remember. And the dehydration would be visible too, I imagine.
For sure. You might see tacky or dry gums. Their eyes might look sunken, and their skin might lose elasticity. If you gently pinch the skin on their back, it might stay tented instead of snapping right back.
Okay. And in really bad cases.
In severe DKA, the metabolic chaos can affect the brain. You might see neurological signs, confusion, stumbling, altered mental state, even seizures or coma in the worst situations.
Okay, clearly any of these signs, especially together, mean get to the vet now.
Absolutely.
Yeah.
Immediately.
So the dog gets to the clinic. How does the vet team figure out, yes, this is definitely DKA?
It's a combination of the clinical signs we just talked about, the physical exam findings confirming things like dehydration, and then crucial lab tests.
Blood tests first.
Yep. They'll check blood glucose right away. In DKA, it's usually sky high, often over 300 milligrams per deciliter, sometimes much higher.
But high sugar alone isn't DKA, right? Just diabetes, maybe?
Correct. High blood sugar plus the ketones and the acidosis is the triad for DKA, so they need more tests.
Like what?
Blood gas analysis is key. It directly measures the blood pH, confirming it's low, meaning acidosis, and the bicarbonate level, which will also be low because it's being used up trying to buffer the acid.
Okay.
They also look at the anion gap. It's a calculation based on electrolytes. So basically, a high anion gap is another strong indicator that there are unmeasured acids like ketones present in the blood.
Got it. And they can measure ketones directly.
Yes. Measuring serum ketones, particularly beta-hydroxybutyrate, is the definitive way to confirm the ketosis part of DKA.
What about urine? Does that help?
It does. A urine analysis will almost always show glucosuria, lots of glucose spilling into the urine because the blood levels are so high,
Makes sense.
and ketonuria, ketones in the urine too. The urine test can also sometimes pick up signs of, say, a urinary tract infection, like protein or bacteria.
Oh, right. Because an infection could potentially trigger the DKA episode in a diabetic dog.
Exactly.
Yeah.
Underlying inflammation or infection is a common trigger, so finding that is important too.
Okay. What else from the blood work? You mentioned electrolytes earlier.
Right. The electrolyte panel is critical for guiding treatment. We often see hypokalemia, low potassium. That's really common because of losses in the urine and shifts into cells.
Is light potassium dangerous?
Very. It can cause severe muscle weakness, including the heart muscle. So monitoring and replacing potassium is vital.
What about sodium?
Usually see hyponatremia, low sodium, often diluted by the fluid shifts or lost in urine, and sometimes hypophosphatemia, low phosphorus, which can also cause problems like red blood cell breakdown or weakness.
And the CBC, the complete blood count.
That often shows leukocytosis, a high white blood cell count. That could be from stress, inflammation, or an underlying infection.
Okay.
And you'll frequently see hemo concentration, basically higher concentration of red blood cells, which is just another sign of how dehydrated the dog is.
So putting all those pieces together, the history, the exam, high glucose, ketones, acidosis, electrolyte issues, paints a clear picture of DKA.
Yes, it confirms the diagnosis and also tells us how severe the situation is, which guides the treatment plan.
Right, treatment. This sounds like an all-hands-on-deck situation in the hospital. What's step one?
Absolutely, it's an emergency. Step one is almost always intravenous fluids. Aggressive 5E fluid therapy.
Why fluids first?
To tackle that severe dehydration, improves circulation and blood pressure, helps flush out the glucose and ketones through the kidneys, and start correcting those electrolyte imbalances. They use specific types of fluids, usually isotonic crystalloids like normal saline.
And then addressing the specific electrolytes that are low?
Yes, that's done alongside the fluids. Potassium is nearly always added to the IV fluids, often right from the start. Phosphorus might be added too, maybe magnesium, depending on the blood results. It requires careful calculation and monitoring.
Okay, fluids and electrolytes. What about the root cause, the lack of insulin?
That's tackled concurrently. Insulin therapy is essential, but it has to be done carefully.
How so?
They use regular short-acting insulin. It can be given as a continuous drip, an infusion directly into the vein, or sometimes as injections into the muscle every hour or two.
What's the goal with the insulin?
Two main goals. Gradually lower the blood sugar, and more importantly, shut down the production of those ketone bodies. Insulin is what tells the body to stop burning fat and making ketones.
You emphasize gradually lowering blood sugar. Why not bring it down fast?
Because dropping it too quickly can cause its own problems, like fluid shifts into the brain, and the biggest immediate risk is causing hypoglycemia, blood sugar dropping too low.
Ah, right. So how do they avoid that?
Constant monitoring. Blood glucose needs to be checked very frequently, like every 1 to 2 hours, especially at the beginning. The insulin dose and fluid type or rate are adjusted constantly based on those readings. It's very dynamic management.
What about the acidosis? Do they treat that directly?
Sometimes, if it's extremely severe, like a blood pH below 7.1 maybe, they might consider giving bicarbonate therapy.
Might.
Yeah, it's a bit controversial and has potential risks like worsening potassium levels or causing paradoxical acidosis in the brain. So it's used cautiously, only when really necessary, and with intense monitoring. Often the fluids and insulin alone will allow the body to correct the acidosis as ketone production stops.
You also mentioned triggers like infections.
Right. Identifying and treating any underlying trigger is crucial for recovery and preventing recurrence. So if there's a UTI, they'll start antibiotics. If it's pancreatitis, that needs specific management. Cushing's disease, kidney disease, whatever else might be going on needs attention.
This sounds incredibly intensive. Constant monitoring, adjustments.
It is, especially the first 24 to 48 hours. They're constantly rechecking blood glucose, electrolytes, blood gases.
Yeah.
It requires hospitalization, usually in an intensive care unit setting.
And watching for complications from the treatment itself.
Yes. For instance, while aggressive fluids are needed, they have to be careful not to overhydrate, which could lead to fluid overload, like pulmonary edema fluid in the lungs. It's a balancing act.
Wow, it really drives home how serious this is. Given all that, what's the outlook? What's the prognosis for a dog with DKA?
It's variable, honestly. The good news is that with prompt diagnosis and really aggressive appropriate treatment, many dogs do recover from the DKA episode.
That's encouraging.
Yeah, they can often be stabilized, transition back to a longer-acting insulin, and go on to manage their diabetes long-term, living good lives.
Yeah, there's a but.
There is. The prognosis becomes much more guarded, even poor, if treatment is delayed, or if there's a really severe underlying disease process that triggered the DKA and is hard to manage.
Like severe pancreatitis or kidney failure.
Exactly. Or if major complications develop during the DKA treatment itself, things like acute kidney injury, sepsis, which is a bloodstream infection, or cerebral edema, swelling of the brain, those significantly worsen the chances of a good outcome.
So like we said, recognizing those signs early and getting to the vet fast is probably the single most important factor in owner controls.
Absolutely. Time is critical. The sooner treatment starts, the better the odds.
Okay, so let's try and boil this down. What are the absolute must-remember points about canine DKA for our listeners?
I'd say number one, DKA is a dangerous emergency caused by insulin deficiency. It leads to high blood sugar ketone production and acidosis, a toxic combination.
Number two.
It requires immediate, intensive veterinary care. We're talking hospitalization, IV fluids, insulin, electrolyte management, constant monitoring. It's not something that can be managed at home.
And number three.
Recognizing the signs is vital for that timely intervention. Increased drinking and urination, lethargy, vomiting, not eating, that weird deep breathing, maybe the fruity breath. Don't wait if you see these, especially in a known diabetic dog, but even if diabetes hasn't been diagnosed yet.
Got it. Early signs mean urgent vet visit.
Precisely. It really can make all the difference.
This whole discussion really highlights just how interconnected everything is in the body, doesn't it? How one hormone deficiency can trigger this massive, life-threatening cascade.
It really does. It's a stark reminder of that delicate metabolic balance.
Definitely gives you a new appreciation for physiology and, well, makes you want to keep a close eye on your furry companions. Thanks so much for breaking down such a complex topic.
My pleasure. Hopefully it helps owners be more aware.
Yeah, lots to think about there regarding how these intricate systems work and why prompt attention to changes in our pets is so important.